Peripapillary atrophy, zone alpha, zone beta. When you look at an optic nerve head, you will see certain pigment variations that are around the optic nerve head. You often find people using terms like peripapillary atrophy, parapapillary atrophy, zone alpha, zone beta, myopic crescent, scleral crescent, and we get quite confused what these individual things are. Let me try and simplify things a little bit. Peripapillary atrophy is also sometimes casually referred to as parapapillary atrophy in certain journals and articles. Zone alpha and zone beta are parts of peripapillary atrophy. So when you combine the zone alpha and zone beta, it represents the overall peripapillary atrophy. Myopic crescent and temporal crescent are also terminologies that are used in textbook that signify the same thing. I will be satisfied for all practical purposes in early stages of learning if you just can identify peripapillary atrophy. I will go through the various parts, zone alpha and zone beta as well, but for all practical purposes clinically, we don't necessarily bog down with individual parts, given that the zone alpha is usually a small part of peripapillary atrophy and zone beta is the larger part of peripapillary atrophy. So let's start with certain anatomical landmarks. When you're looking at an optic nerve head, you identify the scleral lip as the first point. Scleral lip is an even, thin, white line that actually has the boundary of the optic nerve head. If you look at this picture carefully and follow this through, you'll see an even white line which exactly matches the scleral canal and represents the boundary of the optic nerve head. It represents the extension of the sclera between choroid and the optic disc. So that's the scleral lip. Once you outline the boundary of the scleral lip, then you look for zone beta and zone alpha. Zone beta, or which is chorioscleral crescent, is a broader, more irregular, sort of depigmented region of the peripapillary atrophy. It represents the retraction or absence or thinning of the retinal pigment epithelium. In this picture, it is marked with the alphabet B, as in zone beta. When you go to zone alpha, it's the peripapillary crescent region that has increased pigmentation or more pigmentation. It represents a malposition of embryonic fold with a little bit of irregularity and double layer of RPE, hence the more pigment. Now, zone alpha is found adjacent to zone beta, and if the zone beta is not present, meaning it's not there, then the zone alpha is touching the scleral lip. In this case, you can see it's marked with A. That is the zone alpha, the pigmented region. And if the zone beta was not there, let's assume that, then the zone alpha would be closer to the optic nerve head. Now, it is very easy to show one picture and say, well, that's where zone alpha is, and that's where the zone beta is, and individuals will vary a little bit on exactly where the boundary lies. Why is this important? And we'll come to that in a moment. But what I want to tell you or drive down is that it's not always as clear as identified like in a textbook picture. It is a bit more complicated. Now, when you look at this picture, it's obvious this person has peripapillary atrophy. And if I told you, identify the zone alpha for me and outline the boundary of zone beta, it will be quite a bit difficult. Zone beta is a little bit easier. You can look at this and say, all right, well, so that's the boundary of the optic nerve head. You can mark that. Okay, the arrow is pointing it out. Okay, sorry, change here, right this. Okay, so that's the boundary of the optic nerve head. And now this is the region where you would expect the peripapillary atrophy to be. You can see that this is depigmented. There is a light fundus here, but you can still see there is some pigment. This is sort of depigmented. Sort of that should be the zone beta. Well, but wait a minute. All this is also crackled and depigmented. So one can argue, and it's probably true, that all this is zone beta. And if you try to look for the boundary and say, where is zone alpha, which is excessive pigment, you could sort of speculate and say, all right, sort of this region right there, but it's a lot more difficult to identify. The point I'm trying to drive across in this particular case is that it's not always very clear where zone alpha and zone beta is. It is just easier to actually identify it as overall peripapillary atrophy. Now, if you had a large zone beta, which means that there is absence of RPE or retraction of RPE, what we know is that the larger the zone beta to the larger the zone beta area to disc area, meaning if the optic nerve head is 1, how large is the peripapillary atrophy, or in this case, let's say zone beta, if you want to be specific. The larger the zone beta to disc area ratio, the greater is the risk of glaucomatous damage. Now let's take a picture here. This is a healthy patient. This patient has been evaluated both by OCT as well as visual fields, perfectly normal. This was a research participant. Now what we know from this particular picture is that you can look at this and say there is peripapillary atrophy, a significant peripapillary atrophy that can be identified, but the rim is very healthy. Pink rim tissue, the cupping is not too large, and in this case, even though there is a large peripapillary atrophy, and if you did calculate the zone beta to disc area ratio, it would be large, but this person is healthy. So just because there is peripapillary atrophy does not really mean that they have glaucoma. That's an important point to remember. Now here's a person that has a very large peripapillary atrophy. You can look around, see that's the scleral lip is very easy to identify in this patient. Okay, so you can clearly see this eye and look and say that's the boundary of the lip. And if you look carefully, all this is atrophy, all this region. 360 degree, you can see a large peripapillary atrophy present. This patient also happens to have elevated pressure and has visual field defects, not too large, but early enough to signify glaucoma in this particular case. So peripapillary atrophy can come in all shapes and sizes. They don't have to be restricted to one particular region. It can be anywhere around the optic nerve head. It's right outside the optic nerve head. It's not like further away. It's not like a few disc diameter away. It should be around the optic nerve head. And it basically consists of zone alpha and zone beta. For learning purposes, you can just start by identifying the peripapillary atrophy and quantify the peripapillary atrophy with ratio to how large the optic nerve head is. So if you look at this and say, well, if you took all this region of peripapillary atrophy and you compared that to the area of the optic disc, that's probably a little bit over 1 disc diameter. If you actually add this all, take pieces of this, put that on the disc, that'll probably be more than 1 disc diameter for this particular patient. So this is greater than 1 disc diameter of peripapillary atrophy. And peripapillary atrophy is not a constant. It can vary over time. So make sure you write down where is it present and how large is it present. And if you find that increasing, that may signify certain changes or progression in glaucoma.